The Northern Territory has recorded its first death from COVID-19. An elderly Aboriginal woman from the Binjari community died at the Royal Darwin Hospital after contracting the virus almost 2 weeks ago.
It was the moment the Northern Territory had avoided for 20 months. Chief Minister Michael Gunner announcing a woman in her 70s had died from COVID-19.
She was admitted to RDH on November 20 and had bravely battled COVID, including substantial periods receiving additional oxygen. She did have underlying health conditions and she was not vaccinated. On behalf of all Territorians, I extend my condolences to her family and her community at this very difficult time.
The Aboriginal woman had contracted the virus in the remote Indigenous community of Binjari near Katherine.
This is the news we never wanted to give. While we are the last place in Australia to have one of our own succumb to COVID, it is very unlikely to be the last time that we have to deliver such news. Today is a tragic reminder of the severity of this virus, a reminder of why we take it so seriously.
There are now 60 cases in the Katherine cluster. Authorities believe the outbreak began when a woman tested positive after flying to the Northern Territory from Cairns last month. They say she lied on her border entry form, failing to declare she had spent 4 days in Melbourne before travelling to Darwin.
Unfortunately, this death does apparently have links to a breach of Chief Health Officer directions. It appeared to be the seed that started the spread of COVID within the Northern Territory, and as such, Major Crime are now undertaking an investigation.
The Chief Minister has criticised people spreading misinformation to remote Indigenous communities, contributing to low vaccination rates.
I don't know what their motivations are, but they're not good. I think they carry a lot of weight for this. Political, ideological, identity. I don't know why the hell they go out of their way to try and push serious and significant misinformation onto people, but there is no good motive for it.
The Northern Territory recorded 2 new cases of COVID-19 in the past 24 hours, but they're not linked to the Katherine cluster. A man who travelled from Melbourne tested positive in home quarantine, while a woman returned a positive test after flying in from Adelaide.
We've decided to declare South Australia a red zone for the purposes of travel to the Northern Territory. This means arrivals from South Australia will be required to undertake 7 days home quarantine upon their arrival, with additional testing requirements.
Until last month, life in the Northern Territory had been largely unaffected by COVID-19. It's clear that's no longer the case. Matt Cunningham, Sky News, Darwin.